And in addition, they can monitor their numbers at home, and then they can turn around and make changes immediately instead of waiting for the doctor to add medication.
No, that's what I said. I put some in there.
And if everybody can and they have the opportunity, try to put your phone on mute because it's kind of quiet where I am, so it'll always take over. So the first thing I want to talk about is your body weight, fat, what's considered health, and what's considered obesity. So when we talk about your basal metabolic index is your BMI. People are constantly always talking about BMI. I have a whole soapbox on BMI. I don't think it's accurate. But a lot of times our healthcare system is based on the BMI. So basically it's your height to your weight, and it's like squared, and they have some numbers behind it. But as you see right here on the right, it says normal is anywhere from 18.5 to 25. Those are your numbers that you should have in regards to BMI to be considered normal. Anything over 25 to 30, you're overweight, and anything over 30, you start to go into categories of 1, 2, and 3 of obesity. Anytime you are considered overweight, the reason that they use these numbers is because they say it's associated with hypertension, obesity, and other chronic illnesses. But an actual better measurement is your waist to hip ratio. So basically, that is exactly what I said, measuring your waist to your hips. So for men, once you take those numbers and you divide it, you should get 0.9. Anything over 0.9, if you're a male, you're considered at risk for chronic diseases. And then same with the woman. And with the women, the number can range between 0.8 and 0.85. It just depends on where you go. But these are numbers that let you know that your health is in jeopardy. Doesn't necessarily mean you have high blood pressure, diabetes, and all the rest of the chronic illnesses, but you may need to start changing your diet, adding a little exercise. So this is just a little more information about BMI. Unfortunately, BMI is the most widely used one. It's important, but it's not important because it measures your height. It's a general picture of how much body fat that you may have. It's not race-based. So there are, a lot of times we say race is not involved in healthcare, but it is because we come from different cultural backgrounds. We have different genetics. So when you look at BMI, it doesn't consider anything else. So sometimes you can't be worried about it. Other things when you consider with the BMI, it is more, it was a thing that's more focused on men. It's not focused on women. So look at that. Men have more muscle mass than women. They have more upper body strength. Women tend to have more fat because we store estrogen in fat. Sorry, you guys, we have local chickens for some reason. And then men have more mass in general, like in volume. So let's look at it. This is the Harvard Abdominal Obesity Measurement. And these are where the different abdominal obesity, waist circumference. So these are the people that you can go and find this information that I mentioned as far as waist to hip ratio. So if you think about it, people have different body types. We are all shaped different. But depending on your figure, and this is, everybody has different types, but depending on your figure, some people scientifically we're at higher risk. So for example, if you're apple shaped, it's more android body type. So it's more associated with hormonal issues, but you're going to have more abdominal fat, more visceral fat. You're at higher risk for heart attacks and heart disease. You're at high risk for metabolic syndrome. So that's the high cholesterol, high blood pressure, obesity, diabetes, and it comes in a combination. So you may not have each one of those, but it's a combination. And then you have the gyno body type. These are the people with the small waist and the wide hips. You'll see these people tend to have more fat around their buttocks, around their thighs. Most of their fat is peripheral they're at risk for peripheral vascular disease. So I mean things like they may have varicose veins, they may have issues with the draining and all the blood vessels in the legs when the fat is further on that part. They also, because they carry their fat on the lower end, they have lower back pain. Sometimes they have knee pain. So those are some of the risks that people that have the pear shape. And then of course there's the hourglass body shape. Their fat is usually distributed evenly, and they're also at risk for chronic diseases, even though, so no one's not at risk. You just have different risk based on how your body's shaped. So one of the things that I think is important is, so I can tell you about waist to hip ratio all day long, but if you don't know how to properly do it, then you may not get the numbers that you're looking for, the information that you're looking for. So again, I have here, you want to start at the top of your hip bone and then bring the measuring tape up. And you want to go around, and that from your belly button. Can you do it under it? Can you do it above? It doesn't matter. But at the end of the day, it needs to be consistently the same place. So if you're trying to see, am I losing inches in your waist, don't move the tape measure around to accommodate a dream of whether you lost weight or not, or you lost inches or not. You want to consistently stay in the same place. You want to make sure that it's not too tight, that it's straight and it's even across the back. And don't hold your breath. You want to just in your normal posture. You want to check your numbers on your tape measure right after you exhale. So that kind of makes sure that you catch the measurements properly and not while you're holding your breath in. And you want to, like I mentioned before, measure the same way every time. So when we talk about chronic diseases, some of the chronic diseases that I mentioned before is the high blood pressure. Normal blood pressure is going to be 120 to 80. I know the doctors have said that if you're older, there's different blood pressures. If you're this, is different blood pressures. But to not be at risk and to have normal blood pressure, the number is 120 over 80. You'll see some other blood pressures this is again by the American Heart Association. There's the JNC8. They have a different number, but in regards to risk, 120 over 80. I'm just going to keep on saying that. That's the biggest thing that you need to know, because anytime you go higher, that's when they want to start medications. But guidelines state when your blood pressure starts to go up, they want you to change your diet, reduce your salt, and start exercising. And these are the other people that I mentioned, the JNC8. You see, they have two different rules. So one has hypertension. We'll go back to the other slide. You see how one has hypertension stage 2 starts at 140 versus the other one, they start stage 1 at 140. So they actually let you go up even higher before they move the needle or start to offer meds. So either way, at the end of the day, the first thing you would need to do is reduce your salt, and we'll go into later what that means, and add exercise. So things, we want to talk about heart rate because I think that's important. We sometimes get concerned about heart rates, or these are numbers that we don't know. A normal heart rate is 60 to 100. When your heart rate is not within that range, it could be several reasons. Anxiety, of course, your heart rate goes up or down with exercise, meaning exercise heart rate versus resting heart rate. The more you exercise, the lower your heart rate becomes because your body becomes more efficient. Caffeine and tobacco. So that means when you're going to the physician and you're getting your blood pressure taken, if you smoke or drink coffee before, I'm going to say with caffeine, it lasts for a while. If you did any of that prior to, it will cause your heart rate to go up. Of course, medication, we give lots of medication to increase your heart rate or slow your heart rate down, depending on what your other problems may be. You may be a person that you may have some type of genetic disorder, or cardiovascular disease that causes your heart rate to go up, and then we give you medication for it. Don't forget herbs. Herbs work. Many of our medications are made from herbs and different plant origin. All they did was isolate that particular chemical out of it. So never underestimate that herbs won't make your heart rate go up, change your blood pressure. That's the purpose of them. It's natural medicine, but you have to be cautious and have your provider get involved with that. Dehydration will make your heart rate go up. Consider less water to pump around your body. It has to speed up to continue the homeostasis or create a even balanced state of happiness in your body, so it'll speed up. Meditation can actually lower your heart rate. So for those that pray or meditation or just sit outside and deep breathe, all that will lower your heart rate. And then that's the same way with the biofeedback. With the biofeedback, that's breathing, imagery, any of those things can lower your heart rate, and it can also lower your blood pressure. So if you kind of consider when you're upset or aggravated or someone made you mad, a lot of times people like to use the term, you made my blood pressure go up. Well, it can make your heart rate go up. Vice versa, if you think and imagine yourself calm and speak calmness and speak peace, you also can lower all these things. So let's talk about target heart rates. It can range, and when I say target heart rates, these are exercise heart rates. So go back and remember that I said a normal resting heart rate can be anywhere 60 to 100. If your heart rate's a little bit lower, 58, 59, nobody's dying. You're not going to die from it. If it's lower in the lower 50s, then you might need to find out why. If you're a young person, young people could easily be in the 40s and it's no big deal. The doctor's not concerned about it. Your provider's not concerned about it. You could be young and actually be 110 and they're not concerned about it. So it's individual. These are just numbers just to consider. So when you're exercising, you see the age range. The T rate is your target heart rate. So when you're exercising, these are the heart rates that you should be between when you're exercising. On the right, you see the max heart rate. We don't want you to be any higher than that. So if you're in the middle of exercising and your heart rate goes up to the point that you feel kind of agitated and you feel short of breath, just stop for a minute. Stop, take a deep breath. But I still recommend that you get approval from your provider before you start exercising, just in case you have some other issues that warrant not doing strenuous exercise like spin or running or something like that. You may have to do something a little lower impact. Now, that brings us to basic kidney health. Why is that important? It's because I spoke several times about chronic diseases. So the number one cause of chronic kidney disease is high blood pressure and diabetes. And they're actually linking COVID, and I've seen it myself, certain people that were kind of already on the edge with high blood pressure and diabetes, COVID has pushed them over the edge. So now they're having kidney issues. Taking chronic medications like Motrin, Advil, things that contain ibuprofen, things that contain naproxen. So if you're having chronic pain and you're taking pain medications all the time, these things can lower your kidney function. So BUN, blood urea nitrogen, it's just basically the best way I could explain is I call it like it's a waste after product of your kidneys. So your after product saying that your kidneys are managing properly is 5 to 26. It's the breakdown of protein from the body. Foods also. So when you hear a lot of people say, oh, you need your protein, you need your protein, the amount of protein that we are so focused on is probably more than we're supposed to have. I know a lot of people that do bodybuilding and athletic sports and different things. They want to get a large amount of protein in, but your kidneys actually get rid of the protein that you don't need. That's the wonderful function of the body. It's beautifully and wonderfully made. It gets rid of things that it doesn't need until you have damaged it. Then it starts to leave things behind, or it doesn't properly distribute things like it's supposed to. So things that may cause your BUN to change when you see your labs. If you overdrink in fluid, even if you're dehydrated. So let's say you worked out before you came and you sweat a lot and you didn't drink your proper fluids, that will make these numbers off. Alcohol will cause, as a diuretic, it will make the numbers off. Diuretics are diuretics. Those are the things that make you pee, such as coffee. If you urinated too much, it will make your numbers off. Severe liver disease, because it's causing breakdown, you'll see higher numbers. Malnutrition, again, inappropriate diuretic hormones. So those are things like just losing fluid for no reason. A lot of it's neurologically related, the inappropriate diuretic hormone, but that's a whole different story. And then, of course, kidney disease. Other things that you need to consider, the other kidney number that's really, really important is your creatinine. Normal for everyone should be 0.5 to 1.2. It can be higher in males and lower in females, of course, because of the muscles. Causes that may increase, because these are the numbers that your primary care physician looks at. If you have a GI bleed, meaning your stomach, your gut is bleeding, you're seeing blood in your stool, it will cause your creatinine to go up. I mentioned before with the BUN, high protein diets, the bodybuilders that are trying to get 200 to 1,000 milligrams of protein in because they got to build their muscles. Again, they're causing kidney damage. Too much exercise, dehydration, surgery. We already talked about a kidney failure, whether it's chronic or acute. And then, not to think horribly, but some of the things that cause kidney failure, based on some of the information that a lot of people that have mentioned before, is like, for example, if you go in for a surgery and you bleed a lot during the surgery, it reduces the amount of fluid, plasma, blood, red blood cells that's in your body. Then your body is going to choose what's most important, heart or brain, not your kidneys, even though they are super, super important. And it will cause you to go into acute kidney failure. So kidney failure is not always caused by chronic illnesses. And then, of course, people with higher muscle mass are going to tend to be on the higher end of normal. Things that will cause your creatinine to decrease is, of course, dialysis, starvation. I have dialysis in here twice. Low protein and muscle wasting due to illness. So this is your glomerular filtration rate. These just numbers that you need to know. What is considered normal? It is on the sheet. So anytime you have them print off your labs, and I want you to always have them print off your labs. When you go to the doctor, get your labs. Don't just say, oh, the doctor said everything was normal. Get your labs and look, so that way you can ask questions. So your glomerular filtration rate should be between 60 or greater, 60 to 110. That's very important. The other thing is, we mentioned that, reduce high dehydration. So like, let's say you didn't drink enough water when you came that day for your labs. The number can also change, vary by sex, by age. And even though they're steering away from ethnicity, you'll notice on the paper, it'll say if you are a person of African American descent, that they allow a different number for your filtration rate. They're finding that this part of race-based medicine is incorrect, and it's causing people of color to go into kidney failure or miss the fact that they're going into kidney failure sooner because the numbers are affected. Diabetes, of course, can affect your filtration rate. You have to remember, diabetes kills your kidneys. I just want to say that again. Letting your numbers, thinking that a 200 blood sugar is normal, is killing your kidneys. Even people that are borderline diabetic are currently actively having slow effects to their kidneys. It may take 10, 20 years, but it's still affecting your kidneys. It may be no big deal because when you're in your 20s and you're borderline diabetic, nobody thinks that when you get in your 40s, then you may be a full-blown diabetic. And then by the time you're in your 50s, you're in kidney failure. So again, diabetes affects your glomerular filtration rate. So does high blood pressure, the same as diabetes. And then, of course, other things like surgery, lack of blood flow, things of that nature. GI bleeds, of course, because if you're bleeding and nobody catches it right away, you're losing blood, less fluid, kidneys decide they're the last to go. So let's talk about basic kidney health. And I'm not going to go into great detail about this one, but just so you can understand, kidney disease is 5 stages. By the time you get to the 5th stage and beyond, that's when you're usually needing dialysis. They usually start you when you're less than 10%. So if you see at the bottom, it'll say less than 15 mLs a minute. So usually they start treatment around 10. So anything greater than, and I guess if you kind of think about this, all of us are kind of like at close to decreased kidney function. But you, as I mentioned before, I said 60 to the 110 is a normal range. There's also concern when you see microalbumin. It's just basically saying that you're spilling protein. And that's just a basic test that they can tell that you're spilling protein when they test your urine and they collect your urine and they use the little dipstick and they come in and they say, hey, this looks good, this looks good. Ask questions like this. It's very, very important, especially if you have a history of high blood pressure. We want to talk about kidney function. We already talked about it before, but I just want you to be aware. Basically, what happens is in a 24-hour urine test, they can measure your urine volume, the pH of your urine, your electrolytes, and the amount of waste that's coming out, including calcium. The goal, of course, is greater than 30 for normal. And then, of course, they refer you to nephrology when you get below 15. And like I mentioned before, when you get less than 10%, we'll call it a percent, then they usually start you on dialysis. So how much water should you drink? 7 to 13 cups a day. It's very dependent on your age, your sex, your body makeup. That all depends on how much, because someone that might be 5'2" is not going to need the same amount of water that somebody that's 6'3". The best thing to do is just drink your 8 to 10 cups a day. If you could just make your 8 to 10 cups. And with the way things are being offered in our society, a soda here, a juice there, it's very hard to get that much water in. But if you make water your priority over a soda, a coffee, a drink, because remember, your coffee is a diuretic. So if you didn't drink water and then you're also drinking coffee, you're actually losing. So 8 to 10 cups a day, if you can do that. And then, of course, if you are one of these people that have some type of heart disease, some type of vascular disease, kidney disease, I want you to talk with your physician on how much fluid they think you should take a day, because you may be restricted and I don't want you to take any more in than you're supposed to be taking. So adults, when we talk about the chronic diseases, about diabetes and hypertension, it is a good idea that adults take in about 150 minutes of a workout a week. So that's not every day. That's however you want to do it. If you want to do it 30 minutes a day, whichever you choose. But like, for example, I said women, it's good for women to walk because it helps with your bone density. With women, at age 30, your calcium peaks and it starts to go down. And then you end up with things like osteoporosis as we start to age. So walking helps compound those bones in addition to lifting weights. So everyone should lift weights. Different gurus, health gurus say different things, but everybody needs to lift little weights. They need to walk. It also helps reduce, of course, the chronic diseases, but different exercises you could do is you could dance, you could run, you could do yard work, anything that keeps your body moving and keeps you active. Just get your 150 minutes in a week. So that is the end. That is all the information I want to share with you. And now I'm open for questions if you have any.